there's lots of things that we talk about here on Parenting Aging Parents about all types of well, different issues. But so many of us go through Alzheimer's, dementia, your mom with dementia, my mom with Alzheimer's. It's just a common theme.
And I think that people often, there are misconceptions about what exactly dementia is and who might have it. So we are bringing Dr. Tam Cummings. She's a gerontologist to talk with us today. Thanks so much for being with us.
Thank you. Thank you guys for having me.
I think a lot of times people don't realize that dementia can be part of another condition as well. And maybe don't even really understand, or they think that dementia automatically means Alzheimer's, and it doesn't. So let's talk a little bit about that.
Sure. I think that's a great place to start, because it's where the disease begins, and it's where people begin to first be confused about what we as medical people are talking about. So dementia is not the name of the disease. If you've been told your loved one has dementia, you've simply been given the umbrella term for a group of diseases that are terminal brain diseases. So one of the ways that I help families understand is I use cancer as an analogy. Cancer is an umbrella term. It means cells in the body have gone astray and are attacking the body. There's 438 identified cancers, but you understand that they have domains and subsets and variations. So if I said to you guys, I have cancer, you would say, which cancer? And if I said skin cancer, you would say, which skin cancer? What stage is it in? Will your children and grandchildren get skin cancer? How did you get skin cancer? And so you've automatically been programmed to understand cancer, and that it's simply an umbrella term. It's not the actual name of what your loved one has. Dementia is the umbrella term for 128 identified brain diseases that are all terminal brain diseases. So if all you've been told is dementia, you need to use the same questions you would use if the word is cancer with that physician. You need to know, who is your specialist, where will your loved one go for testing, and which form of dementia do they have. Now, we primarily deal with 9 dementias. These 9 dementias are about 98% of all of the dementias. And you have to remember, some of the dementias are so rare, there's only a few dozen worldwide. There's only 50 worldwide. Mad cow disease happens once a year somewhere out of 8 billion people. Some of the dementias attack children, so you and I don't hear about them because the family can care for that person without the overwhelming effects of caring for an adult with dementia. So we primarily deal with these 9 dementias, and the way they work is the same way cancer worked. If you said your mother had dementia, I would say, which dementia? If you said your mother had Alzheimer's dementia, I would say, which Alzheimer's dementia.
Oh, interesting. Okay, because I think that people feel like that's sort of an umbrella term as well. Like if you have Alzheimer's, that means a specific thing.
One thing, and it's actually several different domains of Alzheimer's, including some subsets, and then including variations. And variations could be that your mom is highly agitated, his mom is very pleasant.
Interesting. Okay.
So there's variations within that. And then we use those 9 dementias to help families get better prepared for their doctor for that visit. And so the way you make any medical diagnosis is the doctor is taking your history, your sex, your age, and your symptoms, and then they're removing everything it cannot be. And what they're left with is what it must be. And that's how a medical diagnosis is made. So you remove what it cannot be, and what you're left with is what it must be. So on the 9 most common dementias, while I can't make a diagnosis for a family sitting here, I can help them get better prepared to go back to the doctor with questions by removing the dementias that it's not. So let's start with what the 9 dementias are. The largest dementia is actually mixed dementia. So if you took all of the dementias that are actually mixtures, your loved one has more than one dementia, that's really the biggest group. The biggest named group is Alzheimer's dementia. And Alzheimer's dementia is named for Dr. Alzheimer's. It has multiple domains. It's the one that we most recognize. The 3rd most common dementia are the vascular dementias. And this dementia is telling us something in the cardiovascular system caused this to happen. It's telling us its actual causation. The next one is Lewy body dementias. This is named for Dr. Lewy, and this is a dementia which begins in an area of the brain very close to where Parkinson's begins. And that's an important thing to remember.
Mhm.
The fifth group of dementias are the dementias that we think of as being the younger people's dementias. These are frontal temporal dementias, or FTDs.
Mhm.
And this dementia is telling you the disease starts in the frontal lobes and the temporal lobes, hence the name frontal temporal dementia. It's telling you where the primary damage of the disease will occur. The next dementia is Parkinson's disease dementia. And now we know enough to know that if your loved one has Lewy body dementia, we should be watching for the onset of Parkinson's. And if they have Parkinson's disease dementia, we should be watching for the onset of Lewy body, because these two dementias are considered now first cousins. Another, and we realize it's not unusual to see them together as a mixed dementia. The next dementia is Wernicke-Korsakoff, or alcohol dementia. And now this takes work. You can't have an occasional cocktail Korsakoff. This is a case in a bottle a day. This is somebody who's seriously abused alcohol. The next dementia is a hereditary dementia. It's called Huntington's, and it can be juvenile Huntington's, Huntington's dementia, or Huntington's chorea. So it also has different domains. And then the ninth dementia is chronic traumatic encephalopathy. This is commonly called football dementia. Those 9 are about 98% of all of our dementias. And here's how I would use those 9. My mother is 82. She never played football, so I'll take off number 9.
Right.
My family doesn't have Huntington's in it. Huntington's is inherited. The child is either a carrier or they have the disease. Has died. This is an inherited dementia. My family doesn't have it. I mark out Huntington's. My mother's never had a drink in her life, so she could not have Wernicke-Korsakoff syndrome. She never drank alcohol, so I can mark that one off. She doesn't have Parkinson's disease, so she can't have Parkinson's disease dementia, so I can mark that one off. At 82, she's much too old to have frontal temporal dementia. Remember, this is a dementia we primarily think of people being under the age of 60, so I can take that one off. Lewy body dementia has some really interesting hallucination behavior. There are 4 major hallucinations that this person will typically see. They see children playing. They see bugs, spiders, rats, and snakes crawling on them and biting them. And remember, you and I are hardwired. In our primitive brain, we have a piece that says these are not things we like.
Right.
We see bad people coming to get them. And this can even include a family member that they believe comes and beats them up or is going to come and beat them up.
Wow.
And I think what is one of the hardest ones, the person with Lewy body sees their spouse or their caregiver having sex in front of them, having sex in front of the HEB, having sex in public, or having sex with everybody right in front of them, even though the person is sitting next to them. And they can see this through walls. This could be a spouse, which causes a lot of issues. Their caregiver. My mother doesn't have any of those hallucinations, so I'm going to take Lewy body off. But my mother has weight issues and cholesterol issues and blood pressure issues, and those things all say cardiovascular. At 82, my mother's risk of late onset Alzheimer's is getting higher and higher. And that cardiovascular thing didn't just occur yesterday. This has been an ongoing process of decades. And what we know now is if you have any dementia long enough, Alzheimer's will creep in as well. Now I want to go back to my doctor and I want to talk specifically about vascular dementia of some form, or vascular dementia plus late onset Alzheimer's, and that would become mixed dementia. So that was pretty smooth, right?
Right.
Let's look at my dad. My dad's 85. He actually did play football, but he played 6-man football in the 1950s. And those boys played both sides of the ball, so there wasn't a lot of tackling. There was running. So, but I still let the doctor know, he did play that. primarily we're looking at boys that played from 1970 on.
Yeah.
When
Okay.
I'm talking about CTE. My family doesn't have Huntington, so I can mark that out.
Mhm.
Now, people often say your mother never drank. Well, that's because Daddy did enough drinking for all of us.
Mm.
So Daddy abused alcohol for several decades. So I definitely want to make a mark by Wernicke-Korsakoff to talk to my doctor about.
Mhm.
My father doesn't have Parkinson's disease, so he doesn't have Parkinson's disease dementia, but his only brother died 2 years ago of Parkinson's disease dementia.
Hmm.
So I'm going to make a little note there just to make the doctor aware.
Mhm.
My father, again, is too old for frontal temporal dementia. My father doesn't have the hallucination behavior of Lewy body, so I can take those things off. But every time he had a drink in this hand, he had a cigarette in this hand.
Mhm.
And smoking certainly leads to vascular conditions, and that leads to vascular dementia. And there may be some cholesterol issues there and some blood pressure issues there. So I want to go back to the doctor for my father. And at 85, he's in a much higher category to now develop late onset Alzheimer's. I want to talk to my father's doctor about alcohol dementia, Wernicke-Korsakoff, mention the football.
Mhm.
I want to make sure that the doctor knows his brother just recently died of a sudden onset of Parkinson's disease and Parkinson's disease dementia. Want to make sure the vascular system gets looked at. And on top of all of that sits Alzheimer's, which any brain damage long enough, Alzheimer's wants to creep in there as well.
Yeah.
So there's a possibility I would be talking to my doctor about my dad
Mhm.
over several dementias.
Yeah, it's so interesting. And how important is it to get that actual diagnosis? Because that does affect the potential treatment, doesn't it?
Oh, it affects everything. It
Okay.
affects your children and grandchildren because it's now part of their history, the same way my grandfather's lung cancer is part of my history.
Mhm.
It's part of my medical history now.
Mhm.
We need to know which dementia it is because it determines how the disease will progress, how aggressive it is, or how slow it is.
Mhm.
It tells us what kind of behaviors that this person is going to demonstrate, not because they're doing it on purpose,
Mhm.
but because of where their brain is damaged. So people with frontal temporal dementia, behavioral variant frontal temporal dementia, they behave much differently than somebody with Alzheimer's dementia.
Mhm.
They behave differently with somebody with a different form of frontal temporal dementia. So the type of dementia tells us what behaviors to expect.
Mhm.
It tells us what medications can be used or can be tried or should not be used.
Mhm.
People with Parkinson's dementia and Lewy body dementia are very sensitive to medications. So the dementia, to not know the dementia would be like treating your person for cancer, but never finding out which cancer you're treating them for.
Right.
You've got to know which one it is. And that is sort of revolutionary thinking. That's a way of thinking about dementia that we haven't really done a good job of doing before.
Absolutely.
So as kids with aging parents, if we go to the doctor with our parent, whether it's family doctor, neurologist, and they just say dementia, do we need to press and say, well, we need to find out what type?
What if they had said the word cancer? Would that answer have been good enough for you? And remember, you're looking for neurologists who specialize in dementia. Most neurologists don't have an interest in dementia. It is very much a specialty.
Okay.
It
Interesting.
means finding the testing center in your area to take your loved one to, because it's actually 28 different tests that are done to make a dementia diagnosis.
Wow.
By ruling out the ones we can't have, we've greatly helped our physician and we've empowered ourselves to better understand this is a group of diseases, but we very much need to know which disease it is.
Very interesting.
That
That
is
is something.
interesting.
Yeah,
Yeah.
that is definitely a new way of thinking for me,
Yeah.
for sure.
Yeah, something that'll be good for you and your mom.
Right, absolutely. And then I think also important to know just what you talked about, just the stages, so that once you know the diagnosis, you can also know what to expect.
Oh, absolutely. Staging tools, historically, you've heard of 3-stage staging tools and 7-stage staging tools. The 3-stage tool is primarily designed for neurologists who are doing diagnosing and doing research. It wasn't designed for families. 7-stage tools were designed to give professional caregivers and family caregivers a much better idea of the progression of the disease process. And the reason for that is the same thing both of you noticed in your loved ones. There's something different about mom, but she doesn't look sick. So is she really sick? Because she doesn't look sick. And one of the most unusual things about dementia in any form is people with dementia do not look physically sick here until they've lost a pound of brain tissue. And at that point, they're in stage 6 of the disease. They now have the equivalency of a 4-year-old to a 2-year-old.
Wow.
So knowing the stages of the disease tell you how much time is anticipated that a person will be in that particular stage. It tells you what kind of behaviors are coming, what you can anticipate. It tells you how much brain tissue is gone at this point. It tells you what the mental equivalency is. So
So a helpful tool for sure.
To me, it's almost a glasses half full, a glasses half empty type of thing, because you can look at it. Mom has Alzheimer's, and you look at it and you realize, oh, well, but it's only stage 4, so things are good in that respect. But look what's coming. But for me, as I downloaded the list you have on your webpage this morning, I looked at it and I knew already, but I'm just reaffirming it. Mom's stage 6, and looking at everything. It's like, that's mom, that's mom, that's mom, that's mom. Which it's good to know. It's not comforting, but it's good to know. Exactly where you are.
It is not fun. And I recognize that the information I give people is hard to hear. This is your loved one that I'm talking about in a very clinical manner. But I believe if we give the monster a name, we can't change the monster, but at least you know now that what your mother's doing is she's not pretending. And she's never been pretending. She's simply been responding to brain damage. She's not faking it. Social skills are one of the first things you and I learn. On the day you were born, someone shook your hand, and within a few days, they were holding you up to wave goodbye to people that came to visit the new baby. I mean, social skills started right away. And so that means if I start that social skill of, hi, how are you? Your loved one will continue to respond, oh, I'm fine, how are you? And because they don't look physically sick, families and professionals think, oh, they actually know what's going on. But you watched them hang up the phone and realize that they don't remember they were just on the phone. They have no idea who they were talking to. And that's not really a conversation that has cognition in it. It's just an automatic social thing you and I've been taught to do. It's no different than shake my hand.
Interesting. Well, this is kind of just a sneak peek of the things that you're going to be talking about at the GPS Navigation for Caregivers conference. It's coming up soon. I want to share anything more that you're going to dive into this a lot into even more detail.
Yes, it'll be very depressing when we're finished. We've got handouts have been sent out, so we're going to try to send you home with lots of information. I realize that I'm giving you a ton of information in a short amount of time, so GPS will have things available for you to download online, including we're going to give you a book that I've got that's not quite ready to go to publication, but we're going to give you the digits and the bulk of it that you'll be able to download yourself. It's called the Itty Bitty Dementia Book, and it will include the staging tools that will help you, but also tools that will help your physician get a better idea of what's going on at home, like the activities of daily living, the instrumental activities of daily living. We're going to include some things for you to measure your own stress level. The caregiver death rate before COVID, 2 out of 10 family caregivers die before the person with dementia dies. And it's the direct result of the stress of care. And you've both caregivers, so you get that. The fear is now with COVID in place, starting our next year, the fear is that number may have gone as high as 3. So we're going to give you some materials to test yourself, see how your stress level is, to make sure you are taking care of you as well.
Good.
So it'll be a lot of information we'll get out to folks.
Oh, that is
you
great.
are definitely a wealth of knowledge.
Dr. Tam Cummings, thank you so much for joining us today, and we appreciate all of the insight.
Thank you. And thank you guys for what you do. Thank you very much.
Thank you. Wow, I learned something new.
Yeah.
Yeah, I had no idea. I think this will be really enlightening for a lot of people. Really, the idea of that you really need to know what type of dementia it is, and that there are so many different kinds and the factors and all of that. So, wow.
You're going to be talking to your mom pretty soon and Xing off different ones other than 9 to make sure it's not that.
Right.
Very
Exactly.
good. And don't forget, if you have any other topic you'd like us to talk about here on Parenting Aging Parents, please let us know.